All right, let's dive into the absolute core concepts of infection prevention and control, or what we call IPC. Now, this whole explainer is inspired by the fantastic material from Dr. Abdul Karim's Infection Control Diploma course. Our goal here is pretty simple. We want to break down these key ideas and really repeat them so they stick in your mind. Just think of this as a helpful guide to reinforce what you're learning. It is absolutely not a replacement for attending the course itself. So remember, if any questions pop up as we go, make a note and be sure to ask Dr. Abdul Karim during your Q&A sessions.
So here's the game plan. We'll kick things off with the big what, defining infection control. Then we'll map out exactly how germs spread using something called the chain of infection. After that, we get practical. How do we break that chain? We'll also meet the team responsible for all this, and finally, we'll see how all these pieces fit together to build a complete IPC program from the ground up.
Okay, first things first. What exactly is infection control? Well, in the simplest terms, you can think of it as the #1 line of defense in any healthcare setting. It's what stands between us, both patients and healthcare workers, and harm.
This slide really says it all, doesn't it? Germs are a fact of life. They are literally everywhere, on the surfaces we touch, in the air we breathe, even on our own skin. But, and this is the important part, that doesn't mean an infection is inevitable. An infection only happens when those germs find a way past our body's defenses. And infection control, that's the entire system we build to make sure that doesn't happen.
So let's put an official definition on it. IPC isn't just a list of chores. It's a practical, evidence-based approach. The key words there are avoidable infections. That's the whole point, right? It's all about stopping the harm that we actually have the power to stop. This makes it an absolutely critical part of safe and effective healthcare.
So, if we want to stop infections, we first have to understand how they work, how they travel from point A to point B. And in the world of IPC, we have a fantastic model for this. It's called the chain of infection.
And the strategy is brilliantly simple. Every single thing we do in infection control, every time we wash our hands, every time we clean a surface, every time we put on a mask, it's all designed with one single goal in mind, to break a link in this chain. If you can break even one link, the infection can't continue. It stops right there.
So the chain always starts with the source. You'll also hear this called a reservoir. It's just a fancy word for where the germs live and grow. In a hospital setting, this could be anywhere: a damp sink, a dry bed rail, a countertop, or even on a person's skin.
Okay, so the germs have a home. Now they need a ride. That's the second link, transmission. This is how the germs move around. It might be through direct physical contact, like from a contaminated hand, or it could be through the air, carried in the little droplets from a cough or a sneeze.
And that brings us to the final link of the chain, a susceptible person. This is anyone whose body might not be able to fight off that particular germ. We could be talking about someone with a weakened immune system, or maybe someone who just isn't vaccinated or doesn't have immunity to that specific bug.
So let's run that back one more time to really help it sink in. For an infection to happen, a germ needs 3 things: a place to live, which is the source, a way to travel, which is transmission, and a person to infect, the susceptible host. Source, transmission, host. Remember that, because our entire prevention strategy is built around breaking one of those 3 links.
Now that we know the chain, the big question is, how do we break it? Well, this is where our practical tools come into play. In healthcare, we use a really smart 2-tiered system of precautions to get the job done.
Think of it like this. On one side, you have standard precautions. This is your foundation, your baseline. These are the rules you follow with every single patient, no exceptions, because you always have to work under the assumption that an infection could be present. Then, on top of that, you have transmission-based precautions. These are the extra layers of protection you add when you know, or even just suspect, that a patient has a specific infection that spreads in a particular way, like through the air or by contact.
So what are these standard precautions we use every day? Well, it's the stuff that should be second nature. We're talking about meticulous hand hygiene, using personal protective equipment, or PPE, like gloves and masks when you need them, practicing good respiratory hygiene like covering your cough, making sure injections are always safe, and of course, keeping the environment clean and disinfected. These are the non-negotiables.
Okay, we've covered the concepts and the precautions, but who actually makes sure all of this happens? Who's in charge? Well, that's the job of the infection control team.
And here's something that is so crucial to understand. This is not a one-person show. Not even close. Real, effective infection control is an organization-wide responsibility. It involves everyone, from the top doctors and nurses right through to the environmental and administrative staff. It has to be woven into the fabric of patient care.
Now, leading that facility-wide effort is a specialist called an infection preventionist, or an IP. You can think of them as the quarterback of the entire program. Their main mission is to plan and coordinate all the activities that prevent infections, with a huge focus on finding and isolating those sources to stop germs from spreading.
A massive part of their role is education and training. And as you can see, this isn't just some boring seminar you sit through once a year. It's a continuous process. It starts the moment a new employee walks in the door, and it never stops, from ongoing training to professional development.
But teaching the rules is only half the job. The other half is making sure they're being followed, so the team is constantly on the ground auditing what's happening in real time. They develop tools to measure how well everyone is doing, they monitor for compliance, and, really importantly, they hold people accountable to keep patients safe. And they're also always looking ahead, kind of like fortune tellers, scanning for potential risks. This could be anything from advising on the safest place to put a patient, to assessing a construction project for environmental risks, to planning for the next big outbreak. It's all about stopping problems before they can even start.
So, let's zoom out one last time. We have the concepts, we have the precautions, we have the team. How do all these individual pieces come together to create a powerful, facility-wide program that actually works? Well, it's a very logical, step-by-step process. First, you put together a diverse team. Then, that team does a deep dive with the risk assessment to find the weak spots. Based on what they find, they write clear, easy-to-follow procedures. Next, they train everybody on that plan. And here's the most important part. This is not a set-it-and-forget-it kind of thing. It's a living program that is constantly being audited, reviewed, and updated.
And why is having this formal structure such a big deal? Because at the end of the day, the responsibility for all of this goes all the way to the top. The hospital's governing body, the leadership, is ultimately accountable for the entire program. It's their job to make sure it's in place, that it's working, and that it has the resources it needs to last.
You know, that brings us to what I think is a really powerful way to think about all of this. IPC isn't just another department or a binder full of rules. It is the fundamental promise that everyone in healthcare makes. First, do no harm. It's at the very heart of why we're all here. So I'll leave you with a final thought to chew on. We've talked a lot about how these principles create safety inside a hospital, but how can you take this model of understanding the source, the transmission, and the host, and apply it in your own life, in your community, to help build a culture of safety everywhere?